As California prepares to roll back the mask mandate, the CDC continues to encourage wearing a mask indoors. So which guidance should you follow?
Well, here to answer some of our COVID questions this morning is Lynn Jeffers, the Chief Medical Officer over at Dignity Health St. John's Hospital. Good morning. Thanks for being here.
Good morning, Brandy and Leslie. Thanks for having me.
Yeah, we want to start with the masking issues because our state is going to be easing up on some of those mask mandates. Other democratically led states, they're dropping the mask mandates now for kids in schools, not California on that front. So from a medical standpoint, what's changed? The science hasn't changed when it comes to our kids. Still, the CDC is saying, no, you should be wearing masks. So at this point, who should people be relying on for their advice?
Well, first, you want to know what your local guidelines are, because what they're taking into account are a number of factors. They want to know what the community transmission is of COVID at that time. You're also taking into account the number of people who are vaccinated, the number of people who have had COVID recently. And then for yourself, when you're taking into account risk, you want to look at who are you going to be hanging out with? Do we know their vaccination status, or did they recently have COVID? And you want to know where you're hanging out, right? So are you hanging out in a place that's really crowded, or is it ventilated? And then finally, your own risk. So you need to know your own vaccination status, of course, and then whether or not you're at high risk for COVID, and if you are going to be bringing that to any loved ones that you're concerned about. So all those things factor into whether or not you are going to go with the more lax restrictions or the stricter restrictions. And at the end of the day, people are going to have to make their own choices based on what I just talked about. The public health initiatives will probably ebb and flow depending on how COVID is in that time and whether we get new variants. But at the end of the day, you'll have to decide on your own risks.
Can I follow up real quick? Because the CDC doesn't seem to be agreeing with any of these changes at all. Do you see them changing their stance?
Well, remember, the CDC has to make recommendations for the entire country. So then your local public health departments, like our California state or your county one's going to have to take that and distill it down to what applies to your area and your county and what's happening in your area.
Dr. Jeffers, the White House is saying that it's ready to roll out the vaccine for kids 5 and under as soon as the FDA gives the okay. So how important is it to get young kids vaccinated? Because many people, they look at the mostly mild reaction that kids have if they get COVID, and then they wonder, oh, why should I get my kid vaccinated? So what's your advice to them?
Well, we do know that adults that had vaccines decreased their chance of getting hospitalized by 12, 17 times. Even kids from 12 to 17 were decreased from getting hospitalized 10 times. But vaccines actually decrease your chance of dying from COVID 13 times if you've only had the first 2 doses and 78 times if you're boosted. So we do know that those numbers hold true for 12 and over. The question is, what will those numbers look like for 5 and over, and that's what they're evaluating today. But we do know, unfortunately, that 12 million kids have been tested positive for COVID during this entire pandemic, and kids have died, unfortunately. And of course, any kid that dies, that's one too many. We also know that some of these kids end up with this long haul COVID that I'm sure you've heard about, and other problems from having COVID. So at the end of the day, the COVID vaccine is like any other vaccine. You're trying to weigh the risks to benefits of getting the vaccine. And at this point, the numbers that we have for 12 and over at least show that benefit far outweighs that risk.
When do you think we'll have more of those numbers for long-term issues when it comes to children who are younger?
They are already tracking them now. I know for the 5 and under, they're looking at that at the FDA level actually this week. And then the short answer is, at the end of the day, if you do have questions, especially specifically to your own little one, if you have specific issues and specific health issues, you want to talk to your pediatrician. Just make sure you make the right choice for your own little one.
Okay. Before we let you go, as far as the Super Bowl goes this weekend, I mean, we're 2 years into this pandemic. A lot of people you can see are coming to LA. People are ready to let loose, celebrate a team. So when it comes to Super Bowl parties, what is the advice and guidance there?
Well, we know we can never be 100% safe, right? And of course, we have to balance that with living our lives. So what can you do to try to minimize your risk if you're going to choose to gather? First, know the vaccination and boosting status, if you can, of who you're hanging out with, and of course yourself, get vaccinated and boosted. You might want to think about antigen testing everyone before you get together those home kits. Think about gathering outdoors if you want to be safer. And of course, a little bit of common sense, right? Like washing your hands, staying home if you're sick, masking if you need to, don't share utensils, straws, and cups. And then, of course, take a little bit more caution if you are at higher risk or one of your loved ones or somebody that you're with is at higher risk.
Okay. Thank you so much for that interview, Dr. Lynn Jeffers. We appreciate it this morning.
Thanks for having me.
Have a good weekend.
You too.